Okay, I'm gonna go ahead and do my newborn baby assessment on my baby here. Before I go in the room, I'm gonna check the medical record both for mom and baby. Make sure that I'm aware of the culture of the family. That way I can be culturally appropriate when going into the room. I'm gonna go ahead, do my hand hygiene, knock on the door, go in the room, ask if I can do the baby assessment. So first, when I get in there and I start the assessment, I'm going to just look at the general appearance of the baby, make sure that the skin color is good, make sure the baby is alert, she's oriented, she has good posture, she is crying a little bit, so she is breathing. I would go ahead and use my little measuring tape, check the length of the baby, check the head circumference, put the baby on the scale. All right, and then I am going to go ahead and check the baby's vital signs. So I will check the heart rate on the apical pulse for 1 minute. I will check the respiration rate, and then also go ahead and auscultate the lungs. In the different quadrants, I will also go ahead and check the bowel movements while I do have them here. They are active. Okay, and then I'm going to go ahead and see that the body is symmetrical. Go ahead and sit the baby up so I can check the head. I would feel on the baby's head. I do see that there is a little bit of molding, which is normal. I'm going to go ahead and feel the sutures. I'm going to feel the fontanelles. Make sure that they're here, they're soft. This is the anterior, here's the posterior fontanelle. I will go ahead and make sure that the head is symmetrical, that there's no abnormalities, no cyphihematomas, or any caput. What I will do is go ahead and check the baby's face, make sure that it's symmetrical, make sure it's all proportional to the body. I'm going to check the eyes. I will open them up, make sure that there are 2 eyeballs in there. Go ahead, check the baby's ears. I'm going to fold them back, make sure that they do recoil, also that they are symmetrical to the eyes at the right position, make sure that the kidneys are functioning. I'm going to check the baby's neck under the folds, make sure that her head is able to move, make sure that there's no webbing on the neck. I'm going to check the clavicle. I'm going to make sure that it's not broken, make sure that there's no crepitus or anything that would suggest that the clavicle broke during delivery. Go ahead and check the breasts. There are 2 areolas here. They are developed. I'm going to check the abdomen, check for any type of skin turgors, lessons, anything of that sort. The baby, I'm going to check the nose. I'm going to go ahead and make sure that they put it here, hold down, make sure that the baby is breathing out of both nostrils. Good. I'm going to go ahead and check the baby's mouth. I would check for the rooting reflex. I'm checking for the soft palate and for the hard palate. Also go ahead and check the gag reflex. I'm going to go ahead, check the baby's umbilical cord, make sure that there's no redness, swelling, any type of irritation. I'm going to go ahead and take the baby's diaper off. The baby has voided. This is a female. I'm going to go ahead and check, make sure that the check the labia, check the clitoris. Then I'm going to go ahead and make sure that the baby has had a stool. The baby has had their first meconium stool. I would go ahead, check the hips here, make sure that the legs look okay. I'm going to go ahead and turn the baby over, check the spine, make sure that they're, check the skin. There are a few Mongolian spots, which would be normal for a Hispanic baby. I'm going to look at the diaper, under the diaper, I'm going to check the anus, make sure that there are no holes that aren't supposed to be there. And then I am going to go ahead and check some of the baby's reflexes. What I would do here, I'll go ahead and do the crawling reflex. Good. Okay. I'm going to go ahead and do the trunk incurvation, where I go ahead and go on one side and make sure that the baby does move to that side on each side. Good. And then also going to check the baby up, the stepping reflex. And then I'm going to lay the baby down. I would do the moral reflex, which makes sure that the baby reacts. It's also called the startled reflex. I already did this rooting and the sucking reflex. To go ahead and have the baby blink, I can go ahead and touch in between the baby's eyes, make sure that they react and blink. I will go ahead and check the palmar grasp, check the plantar grasp have them grasp your finger with the toes. The Babinski reflex, I'm going to stroke the sole of the feet so the toes can flare. Also going to go ahead and check the tonic neck reflex. That's also sometimes called the fencing reflex. So you go ahead, you move the head to one side, and then hopefully the baby's arm and leg turn, and then it looks like a fencing position. I'm going to check the rooting, so I'm going to stroke the cheek, make sure that the baby's head turns to go ahead and go into that feeding position. Also going to go ahead and check, make sure that the skin everywhere is good. I'm going to go ahead and do the Ballard scoring. So I already said that the baby has good posture. I'm going to do the square window. And then also go ahead and do the arm recoil. So make sure that the baby's arms recoil back up. I can't bend that, but I'm going to do the popliteal angle. And then also the scarf sign to the side. And then the heel to ear, which the babies shouldn't go all the way or too far back because this is a term baby. So after I check all of that, I did the hips, checked the legs, the feet, the arms, make sure that they have two arms, make sure that they're symmetrical, that they are functioning, that they're not leaning or not moving one arm, because that can be an indication again that the clavicle was injured or broken during the birth. I'm going to go ahead and ask also about feeding, make sure that the baby has been eating, and any other questions regarding the baby, making sure that the mom is doing okay, and that see how her reactions are with the baby. And that's it.